We were just talking about specific programs. Ben, I'm going to ask you to highlight a specific program that Red Hat's been working on to enable this capability.
Yeah, I'm really excited and honored to talk about Mission Daybreak. We were a part of that initiative last year. That was a $20 million grand challenge to reduce veteran suicide. And
Mm.
Red Hat and our team Guidehouse that we were in, we placed in the top three. For that, it was like 1,400 companies participated in the competition. It was an incredible effort amongst the community to really bring innovative ideas forward. And what's really interesting is, at least for our solution, we highlighted a lot of the things that have come up on this call. So, for instance, a big part of our approach focused around health equity and the use of social determinants of health in the actual care of the veterans, in addition to delivering risk profiles to the point of care. And that social determinants of health bit, I think, is probably the most impactful because it impacts the entire veteran population, even those who are not getting care at the VA. And the way that works is because of the way we're tracking and capturing the data, we actually have a way to measure the quality of the programs that are within the communities that the veterans live in. And we can actually provide feedback on whether those programs are working or not. And that can really help guide VA's investment and divestment in those community programs, which of course affect all the veterans, regardless of where they might be getting their care. We use that rich social determinants of health data to also produce the risk profile along with the electronic health record and social media data to provide an actual risk score for the patient, for suicide ideation specifically, and then actually provide guidance back to the clinician on what they can do in the next steps. It's one thing just to tell the clinician this patient's at risk for suicide. It's another thing entirely to say, and here are the steps you can take right now to make a difference. Here's their PAC team. Here's the care coordinator you want to speak to. And then actually behind that, we're actually creating the process flows. Those workflows themselves are being modeled so that we have a closed loop system of escalation for that patient. And that approach transcends everything, right? Like we can do that for telehealth, we can do that for the point of care. It can happen in a digital twin, Gary. Like there's just a lot of different ways to approach that, and the modalities are sort of endless. And we can meet the patient wherever they might be. So the actual monitoring systems itself can go all the way into home care.
Yes, fascinating.